Hi and welcome. I'm Shannon Piper, Director of Marketing Content here at Lexipol, and I am so pleased to welcome all of you on behalf of Lexipol and our digital media communities, Police One, Fire Rescue One, and EMS One. We are really honored at the response to this webinar. It has just been overwhelming. We have hit our attendance limit, and this does mean that we unfortunately did have to turn a few of you away, a few of registrants away, but we are recording the session, and anyone who's registered will receive a link to the recording later today. So just know that if a colleague of yours wasn't able to get in, they will be able to watch it, and we really appreciate the response. Joining me is our speaker, Mike Taigman. You can see him on the screen there. Hi, Mike. I'm going to give you a little bit more information about Mike in just a little bit, but I do want to go through a few notes first. So if you're new to Lexipol webinars, welcome. We have a lot of new registrants joining us today, and we're really pleased to have you. If you've attended one of our webinars in the past, you know that we often address some really weighty subjects. We get into case law, we get into legal issues, and I want to let you know that today is going to be a little different. I think that's really appropriate too, because COVID-19 really turned a lot of things upside down in our worlds, and especially in your worlds. So I think a little bit of a different approach is great. You're still going to learn a lot. Everything you're learning is still based in research and science, but this presentation, I think, will engage your brain in just a little bit of a different way. And it's going to move really fast. Mike's going to go fast here. So he has helped us build a post-webinar resource page. So when he's going through his slides today and he's throwing out resources, don't feel like you have to scramble and write everything down. We're going to get that information out to you via email by the end of the day today. You can also see a link in your chat field right now, and that's the same page you're going to get via email. That's going to have all of the resources that he's referring to, and it'll also be where we post the recording later today. Just a couple more bits of information for you. Questions. We know you probably have them, and Mike is super passionate about this subject, and I know he wants your questions. So please send in a question anytime during the presentation. We're going to try to take as many as possible at the end of the session. And certificates of attendance. There are a ton of you on the line today, so please be patient. Give us a little bit of time, but we will be issuing certificates of attendance as well, and those will come to you via a separate email, so do watch out for that. And then if you forget all of this, or if you have any questions about any of it, the recording, certificates, anything, just reach out to us at webinars@lexipol.com with any questions. Excellent. Now it is my extreme pleasure to introduce our speaker, Mike Taigman. Mike has been teaching EMS providers, healthcare providers, fire professionals, law enforcement officers, basically everybody in public safety and healthcare for nearly 40 years. And his current position is as the improvement guide at First Watch, which is a company that helps law enforcement, fire, and EMS agencies improve situational awareness, operational performance, and clinical patient outcomes. At First Watch, Mike serves as the lead for the Resilient First tool. That's Resilient First, and that's a tool that helps individuals and organizations in emergency services improve their ability to manage and recover from day-to-day stress and acute stress. So very relevant to what we're talking about today. Many of you know Mike. He's a frequent contributor to EMS One. He teaches at conferences all over the country. He has been a widely published author for many years, and he served for decades as an assistant professor in the graduate program in Emergency Health Services Management at the University of Maryland, Baltimore County, and more recently as an assistant professor at the University of California, San Francisco. Mike is working with world-leading physicians and researchers to bring neuroscience-based resilience education and practices to the EMS industry. So we are very honored to have him here, and I will turn it back over to you, Mike. Thanks.
Thank you so much, Shannon. And good morning, good afternoon, good evening, good middle of the night, folks, wherever you're logging in from. This is it's a pretty cool virtual circle. I'm coming to you from my garage here in Santa Barbara. I know that we have got other folks in this circle. We've got paramedics and ambulances in Oakland that are logged in right now, police officers and patrol cars in Chicago, emergency nurses and physicians in New York City. I've got psychologist friends in the UK that are logged in, and I've got neuroscience friends and partners in Australia who are logged in right now, even though it's 4 a.m. And a whole bunch of you logged in from your homes and living rooms. So I'm grateful for your being here today. While this session is absolutely focused on emergency services and healthcare, folks who are outside of these professions will certainly find benefit in what we're talking about here today. And as Shannon mentioned, please post your questions. We'll get to as many as we can at the end, and I understand if everything works right. For any questions we don't get to, we'll get a list and an email list and get them out to you at the end. There were 9,600 people that registered for this workshop and only 3,000 here. So if you're listening to this on recording, I'm sorry we didn't have space for you in the virtual circle. We're going to dive through a lot of stuff here quickly and asking that question. So what stresses you out, and what stressed you out 2 months ago may be different than what causes you stress today. This virus has knocked the entire world collectively on our tail, and there's a little bit of science that's been done so far. They did a research study on folks that were working in China and looking at their mental health for the folks who were handling the COVID situation there. They found that 54% of them were dealing with depression, 44% with anxiety, 34% having difficulty sleeping, and 71% experienced distress. Here in the United States, the folks at Statistica just did a survey last week that looked at America's biggest worries around COVID. And the biggest number was being worried about a family member developing a severe illness, impact on financial situations as people, some people looking at their 401ks going down, a whole bunch of other people really out of work at this point in time, and people being notified that they might be furloughed. The stress around all that is significant. They're worried about spreading the virus. They're worrying about getting sick themselves, worried about having to go to work while sick. And these are normal people in the survey. These are not folks who work in emergency services or healthcare. And quite frankly, you folks are different. And when I look at images of the people who are working associated with this virus and working to serve communities and take care of folks who are sometimes deathly ill or may not have survived. The image of you being warriors really comes to mind. And that most of you are familiar with the typical recommendations around stress management. Things like you're supposed to eat healthy, you're supposed to exercise 30 minutes a day, you're supposed to get plenty of good sleep and rest, avoid caffeine and alcohol, and socialize with your friends and stay connected. And the problem is, in a world of coronavirus, many of these things are not available or not as available as they used to be, even though there's still good stress management recommendations. And for those of you that work in emergency services, everybody else is told to avoid sick people and to stay home. And the work you do requires you sometimes to run toward sick people, be around them all day, be at work, be out in the public and interacting with folks. So and kind of inspired by the image of really thinking you as warriors, we're going to start with looking at how the U.S. Army approaches preparing people to go into battle. There's this framework called BATTLEMIND, and I've adapted it more for our emergency services. But when you're combating COVID and combating this disease, it's helpful to understand the nature of that kind of combat. It is intense. For some of you directly exposed to situations that can be life-threatening. Fear is absolutely common. My particular bias is if you're working in this world right now and you're not a little bit afraid, you may need to seek professional help. It impacts everybody psychologically and emotionally, and it also causes a tremendous strain on families. And Unfortunately, with our inadequate healthcare system, inadequate personal protective equipment, potentially inadequate ventilators and medications to manage people who need to be sedated when they're on ventilators, it can set us up to make some moral and ethical decisions that we hope most of us never even considered the possibility of making in our lifetimes. So the objectives of this training, this kind of battle mind training for you to deal with this situation, is to help build your strength so that you can face the fear and do the work you need to do. And give you some really tangible tools to dial down your emotions in the moment when you're experiencing them, recover faster from particularly stressful situations, and that will be a cycle of having emotions and recovering and having emotions and recovering, because this is going to be a marathon that's going to go on for quite a while. To give you some tools to begin to help build your resilience, that ability to advance and continue to live your world and live your life despite adversity. We'll also touch lightly from a leadership perspective on some of the things to be able to lead effectively in a world like this. I want to be really clear that this content is not stuff I invented. I drew from a lot of important teachers. I've got Dan Siegel here from UCLA Medical Center, Dan Goleman from Harvard, Lesia Appel from UCSF, Yuri Rosso from our friend in Australia. I believe he's actually on the line with us right now, a neuroscience expert, and Robert, who is one of the world's stress management experts at Stanford University. So I'm going to ask you to think back just for a moment, and I presume most everybody who's on this has learned to drive at some point in time, and I want you to think back and think, who taught you to drive? For me, it was the neighbor lady, because my parents were too nervous to be in a car with me, so the neighbor lady taught me to drive. But when you think about learning to drive, that's a memory you pull up from the past, and you're clear that that's something that happened in the past. But probably a couple of you, some of you may have been home for quite a while, but within the last couple of months, most of you have operated a motor vehicle or a motorcycle. You have driven, and it's actually memory neurologically that allows you to be able to use the gas pedal and the accelerator and use the steering wheel and not run into anything and those kinds of things while you drive. And those are two different kinds of memory in your brain. In your brain, that first one, that memory of pulling up the experience of learning how to drive from the past, is referred to as explicit memory, lives in the hippocampus in your brain. And that memory of just knowing how to drive, even though you don't experience it, is something you pull up from the past, is referred to as implicit memory. It's something that you just know how to do. So for those of you who are on this call who are in law enforcement, you probably just know how to secure your weapon when you're wrestling with somebody and not have your weapon removed. That's implicit memory for you. Those of you in healthcare, you know how to do CPR. You can do CPR effectively, even if you've been awake for 72 hours. That's implicit memory. So what I want you to think about as we go through this, I'm going to cover a whole lot of different strategies and things for you, as Shannon mentioned. Don't try to remember it all. There's going to be way too much information to take it all in. But what I'd like you to do is to kind of look for one thing that really kind of resonates for you and think, I'm gonna spend enough time with that it becomes implicit memory for me, so that in stressful situations, it's something I just do to take care of myself right in this moment. I don't have to think about it. I don't have to remember about it. It's just something that is part of who I am. That's what that's what I hope you identify something and pull out of this session. So we're going to spend a little bit of time in neuroscience here and how your brain works. This is your brain on a webinar. There's a few of you on here old enough to remember that joke. But this, the green part of your brain here on this slide, this is your brain stem. This is the part of the brain that essentially differentiates you from a head of cabbage, encourages your heart to beat, regulates your temperature, reminds you to take a breath on a pretty regular basis. The next part of the brain is the limbic system, and the limbic system is the seat of all of your emotions. So happiness, joy, love, fear, disgust, anger, all of that really lives in your limbic system. The next part of the brain to evolve is the neocortex. This is the thinking part of your brain, that part of your brain that is involved in conscious thoughts and particularly prefrontal lobes of your neocortex. It's important to understand how this works when it comes to stress. The prefrontal lobe is also referred to as your executive center. Some people refer to it as the smart brain. And this is the part of the brain that's involved in waking memory. So whatever is going on in your mind right now is going on in the prefrontal lobes of your neocortex. This is also that part of your brain that exercises impulse control. So that when you're in a grocery store and somebody coughs and then covers their mouth with their elbow after they have coughed, it's the impulse control that causes you to not run your shopping cart into them to remind them to protect you from their droplets. It's also for those of you that consume alcohol, it's the first part of your brain to be affected by the consumption of alcoholic beverages, and that's why people lose impulse control around that. Next part of your brain is the thalamus, and this essentially works like the 911 communication center and switchboard for your brain. It takes in information from your auditory nerve, your optic nerve, your proprioception, all of your nerves, and it moves them to different parts of your brain for understanding and potential action. Right next to the thalamus are two little pieces of almond-shaped pieces of neurologic tissue called the amygdala. And understanding the amygdala and how the amygdala works is key to managing your own stress and being able to understand and work with stress in your peers, colleagues, the public, and patients and people that you're taking care of. The amygdala functions basically like your body's lifeguard. It's your body's sanctuary. It is on duty 24 hours a day, 7 days a week, 365 days a year, and it is constantly asking questions of every sight, smell, and sound in your environment. And the three questions, the first question is this something I can mate with? Is this something I can eat? Or is this something that is likely to eat me? And if it gets a no answer to these questions, it does absolutely nothing. If it gets a yes answer, it activates a cascade of neurochemicals that inspire emotions. So if the answer to can I mate with it is yes, it inspires the emotions of love, joy, happiness. It essentially activates your parasympathetic nervous system. For those of you who remember your early education, it's the relaxation response is mediated through the vagus nerve, as shown here in this picture, the longest nerve in your body, and is the one that is part of the relaxation response that is talked about in so much stress management. On the other hand, if the answer to the question, is this something that is going to eat me, harm me, or potentially kill me, you get the sympathetic nervous system response of fight, flight, freeze, or faint response. Many of us, back when we were in elementary school, learned that there's only fight or flight. It turns out freeze and faint are also options in this response. And some of us have a more hair-triggered response to these kinds of stimulus. Some of us are cool, calm, and collected. We can go through stressful situations, stressful circumstances without any worries or problem at all. Others have just a super hair trigger and get activated really quickly. And the thing that's important to understand is that this system as it lives in most mammals and animals, and it is key to keeping us alive. This startle and stress response is life-saving. If you are working in the field as a police officer, firefighter, EMT, paramedic, and you're on a scene and you hear the sound of a shotgun being racked in the room next or in the room right next to where you're taking care of somebody who's sick or hurt, that startle response is life-saving, can be life-saving for you, just like it's life-saving for this deer. It can be a very essential response to a real threat. The difference between us and as people and the rest of animals is we've got this great big brain, and this great big brain can allow us to not only respond to actual threats in the world, but we can imagine and create all kinds of things. And one of the issues is that it can go on and on and on and on and on without being shut off. Not something that we believe other animals in the animal kingdom experience. This seems to be a uniquely human trait, and this is the kind of stress we're talking about. And you can hear it used as various different phrases. Some people will call it there can be critical incident stress or compassion fatigue or leading to burnout. These are all kind of the same wine in a different bottle, all part of the same kinds of stuff, and it has real impacts on our bodies. Inflammation is a part of the stress response. It can have effects on our telomeres, and for those of you who are not medical or scientific, telomere are these little end caps on the strands of DNA in our cells, and they are the essence of the aging process, and also have to do with the precursor to disease. You can kind of think of them like they would be end caps on your shoelaces, and they keep everything from getting unraveled. And when it gets frayed and unraveled and shortened due to certain things in the world or over time, it is the setup for cancer, inflammation, and is the root of aging. Now, it's really interesting. Alessia Espo and the team at UCSF and a number of other researchers around the world have found that there are things that you can do in your daily life that can lengthen your telomeres and shorten your telomeres. And longer, healthier telomeres means you're less likely to get diseased. You're going to live longer, and you'll be basically happier and healthier in the process. So things that shorten your telomeres are chronic threat stress, and we'll talk about the difference between threat and challenge stress here in a couple of minutes. All the things your parents told you not to do: smoking, eating processed foods, too much added sugar. Those are all things that will shorten your telomeres and set you up for more disease in the world. On the other hand, the things that they tell you should be doing: eating your fruits and vegetables and whole grains, getting 7+ hours of deep, restful sleep every night, spending time in nature. They did a fascinating research study. They were at a conference, and they had several hundred people. They went and drew all their blood samples, so they had a baseline a set of measures on their telomeres, and they had half of the people stay in the conference center, and the other half of the group they sent for an hour-long walk in a nearby park and nature and trees and all that kind of stuff. And then they brought them back in and redrew blood from everybody and remeasured their telomeres. And just an hour-long walk in nature measurably lengthened the telomeres for participants. So you can have little things that you do that have really meaningful action at a cellular level for your stress and your health. Also, the practice of mindfulness, and we will spend more time on this. One of the more scientifically validated and researched strategies to make a real difference in your life and stress. So this inflammation, shortening of telomeres, oxidative stress, damage to cells. This is the setup for high blood pressure. It is the setup for obesity. It is the setup for diabetes. It is the setup for cardiovascular disease. It's the setup for strokes and neurovascular disease. It's the setup for all different kinds of cancers. It's the setup for over 100 different types of autoimmune disorders. And it's also, from a psychological and emotional perspective, this is the recipe for depression, anxiety, burnout, compassion fatigue, post-traumatic stress disorder, or some people refer to it as post-traumatic stress injury, giving the suggestion that it is treatable and recoverable, which it absolutely is, and the setup for people who are potentially suicidal. So the question is, with all of these kind of issues around stress, what do we do? What kinds of things can we do in order to deal with it? And these are all choices you can make. Some people in the world, they make the choice to just continue to deal with it and do nothing and continue to suffer. And this, sets them up for the equivalent of a brain injury, if you will. Some people, Dr. Aman and his folks who believe a lot of psychological and emotional things, have their roots in anatomy and physiology with brain, and they his clinic tends to treat people as if they have brain injuries from the psychological perspective. I don't mean to say that he's correct, but his stuff is very interesting to look at and explore. Some people have really maladaptive responses to stress, where they smoke and drink and use drugs and those kinds of things as an attempt to cope. One strategy can be getting away from it. When this coronavirus thing really hit, I'm a pretty active person on Facebook, and any of you are welcome to friend me. I'm also friendable on LinkedIn, and I'll give you my phone number and at the end of this to contact if you want to chat about stuff. But one of the things I noticed with a lot of my both law enforcement, nursing, and paramedic and EMT friends on Facebook is that the number of retirement announcements has gone up significantly over the last several weeks, which can be kind of a getaway from the stress strategy, and that, depending on your circumstances, can be a legitimate choice. Sometimes with stress, people try to change the stressor, and that in a situation, our ability to actually change the virus itself is unlikely. But just because the virus is out there doesn't mean that there aren't relationship issues and those kinds of things in your world and with your coworkers, with your bosses, with politicians or whatever, and those kinds of things in the world. Trying to change the stressor can be effective, but it tends to be a lot of work. The stuff that works best, the stuff that is most under your control, is really the ability to change your own brain and how you think about and respond to stress. So remember, I suggested finding one of these strategies. I'm gonna go through a bunch of them here that you can use to be able to deal with your stress. One of them, and this actually comes from the law enforcement the world, is what was referred to as crisis rehearsal, and it is a training technique that is used in many law enforcement circles, military circles as well, where you kind of close your eyes and you imagine a worst case scenario. Imagine having a patient who is diagnosed positive as COVID sneeze in your face, and your mask is off to the side and not sealed at that moment, or whatever the particularly stressful situation is. And what you do is you always in your rehearsal always rehearse being successful, winning, coming out on the other side healthy, functional, and happy. You never want to rehearse disaster for yourself. You want to be able to rehearse things in such a way that you practice them in your mind, so that when you're faced with an actual situation, that you'll be able to handle it more effectively. And there's something about imagining yourself practicing succeeding, being successful, and getting through things uninjured and unharmed, that trains your brain to be able to deal with stress in a different way. I'll give you another example. This one comes from my wife and son. She's in the living room right now, and my son's on his own Zoom deal with a bunch of other second graders doing Zoom. But our son, Axe is his name, is 8 years old, and this was a few months ago. He was eating dinner in front of the television, which I know is bad parenting, but we do it anyhow a fair amount. And he was eating a rigatoni with marinara, and he likes a lot of marinara sauce on his food. And he still had half his bowl left, and he was carrying it back into the kitchen, and he tripped over one of his mini Legos. And my wife, Sasha, who's listening into this story as we speak right now, was standing in the kitchen, and I was able to see her face as he's kind of launching this kind of Rorschach of marinara sauce out of the bowl as he's falling. And Sasha, she really likes white furniture. We've got a white sofa, we've got white club chairs, we've got white table, we've got white floors, we got white paint on our walls. So she's saying kind of this Jackson Pollock spray of marinara sauce, and I saw that initial look in her face, that startle response, and she's been working on her resilience as I've been studying this stuff. She's been exploring it as well. And she actually took a quick breath and she muttered under her breath, she said, "What am I feeling right now? What am I feeling right now?" And she got this look on her face and she said, "Surprise. I'm feeling surprised." And she looked at our son Axe. She said, "Axe, I'm feeling surprised. Are you feeling surprised?" And he looks up and he goes, "Wow, Mom, it's like I'm surprised that those are the words that are coming out of your mouth right now." And she said, "Well, let's just clean it up." And before understanding this principle about being able to intentionally label your emotion in the moment you're having it, 6 months ago, that would have been an upset mom and a feeling bad little kid. Instead, it was just, hey, this is a mess. We'll just clean it up together. So that process of labeling your emotion in the moment and actually, giving a verbal word to it. I'm feeling I'm feeling afraid. I'm feeling pissed. I'm feeling sad. Whatever it happens to be, that gives you just a little bit of extra distance on it to calm yourself down a little bit. It's also helpful to hit the pause button several times during the course of your workday. And by pause, I'm not talking about checking out and being unsafe or anything like that. And it doesn't have to be for a long time. It can be for 10 seconds. Many of you are warm beverage consumers, and one of the things that has worked for me in the past is when I'm going to take a drink of a cup of tea or a cup of coffee, really focus on that drink just for a minute. And while I'm smelling it and anticipating the taste and bringing the taste up to my mouth and having a swallow and just being fully present for that, just for that moment, pulls you out of the other parts of the stress response. And there's no doubt that people are worrying a lot about all kinds of things around the coronavirus. So one of the strategies you can use is to actually schedule yourself a 5-minute worry session. Go ahead and put in your smartphone calendar or whatever you use to track your day, and actually write down, I'm going to worry about COVID for a specific period of time, and then set yourself a little alarm and say, I'm going to give myself 5 minutes, or if you really need to worry a lot, worry for 10 minutes and just fully indulge in the worry for that 10 minutes and schedule it daily. And then when the alarm goes off, you can relax a little bit and say, my worry's done for that day. I've worried enough about COVID for right now. It doesn't mean you're not going to think about it later on, because you will. But knowing that, okay, I've worried about it, and I'm going to worry about it the same time tomorrow. I've got my worry time scheduled, can kind of set it aside a little bit. Another strategy, we're all washing our hands. It's frightening to realize how many people have learned how to wash their hands for the first time over the last couple of months. That's neither here nor there, but hopefully you've all got the full 20-second hot soap and water hand washing thing down. And it really is helpful to have super soapy, sudsy hands and hot water. The virus has a little bit of a fatty coating to it. So hot water and soap really breaks down that fat and renders the virus itself inert. It's not technically alive, but it renders it inert. So one of the things everybody talks about singing happy birthday twice, or my son sings the baby shark song when he's washing his hands to make sure you get your full 20 seconds. Another thing you can play with is really during the time of washing your hands, think about two things, one for each hand, that you're deeply grateful for. Whatever it happens to be. Somebody, a friend of ours just set up a system to supply 500 N95 masks to our local hospital here in Santa Barbara every day, and it's got a pipeline and a shipment and a system set up, and he's not in the healthcare business, he's not in the healthcare supply business, but he's a smart guy and well connected, and he managed to set that up, and I'm grateful that he's providing N95 masks. Maybe you'd be grateful that your spouse's diagnosis turned out to be the flu and not COVID. Maybe you're grateful that your regular checking of Amazon you managed to catch when toilet paper was actually available and you got an order in, and the toilet paper is actually coming to your house. Whatever comes up for you from a gratitude perspective. Grateful is part of a parasympathetic nervous system mindset and response, so it can decrease your stress response. Spending a little bit of time outside in nature, not on your phone, not reading an article, just give yourself 30 seconds to look at a tree or flower or the clouds overhead, depending on where you're at, but just the little bit of time to connect with it. We saw earlier the research that it can actually shorten your telomeres. If you've got a dog, your dog may be stressed about this, get your dog out for a walk and do that kind of thing. And use the things you're already doing during the course of your day to just intentionally give yourself a little bit of extra time. So if you're somebody who normally takes a 5-minute shower, just give yourself permission to take a 7-minute shower when you take a shower, so that during that period of time you can really unplug. One of the dynamics of the stress response is you kind of get a laser focused vision. And that tunnel vision is in the right circumstance, it can be life-saving. Back when this neurologic system was invented, there'd be a saber-toothed tiger over in the corner that hadn't eaten for 2 weeks and looked tasty with barbecue sauce on. So I want to focus on just tiger, not butterflies flying around and all that kind of stuff. I want to deal with just the tiger. And there are potential saber-toothed tigers in our world, and we do sometimes need to deal with that. But a lot of our diffuse stress can cause our tunnel vision to bounce from one bad thing to another bad thing. And if you can remember that your focus is a tool that you get to control. So whatever you're focusing on is something that you can choose. So you can choose to focus on something that is less stressful than the immediate threat in front of you, as a way to calm yourself down. Those of you that are actually at work and on the front lines when you're dealing with stuff, the military folks would say, just focus on your mission critical tasks. Don't focus on, there's so many things you can think about. Just focus on just exactly what needs to be done for yourself right now. Another stress management trick is to reframe your perspective. When you take a look at something and it's like, or you have a thought and it's like, oh, this is particularly scary, and you realize that something is a little bit off, you can reframe and change your perspective. So in your mind, going to the other side or flipping it upside down, and how would it look like if it was upside down? Those kinds of mental tricks change things for you. And when you've really got something very focused on that you're frightened about, asking yourself this question: can I change this? Will I change this? And if the answer to that is yes, then change it. If you can change it and you will change it, then make the change necessary to deal with things. If it's not something that you can change or that you're willing to change, just like a balloon, let it go. Let it go. And being clear, can I or can't I? And if I can't, just let it go. Now, most of you at some point in time in your life have seen a picture similar to this one, where you've got a gazelle being chased by a leopard. Both of these animals are having an acute stress response at this moment. The gazelle is having what's referred to as threat stress response. You get heart rate increased respiratory rate, your peripheral vasculature clamps down so that you get your blood available to the major muscles to move things quickly, your vision tunnels like we described before. But realize that the leopard is also having a full-on stress response. A stress response being, if I don't get this gazelle, I'm not going to eat, and I need to eat for survival. But the leopard is experiencing what's referred to as a challenge stress response. Now, inside your body and inside your mind, a threat stress response that goes on for too long sets you up with the inflammation, the shortened telomeres, all of the disease issues and the psychological problems. That's really the kind of stress we're worried about dealing with. Challenge stress, on the other hand, if you experience something as a challenge, it actually builds your resistance. It actually strengthens your immunologic system. One of the tricks when you're experiencing fear or something like that is to see, how can I change this into excitement? How can I catch that fear and transform it into excitement? And the scientific name for this is reappraisal. Cognitive reappraisal. They work with it. Therapists will work with people around it. And this is an interesting research study. They took a group of people and put them into a stressful situation. And one of the most stressful things in our world before coronavirus was public speaking. Public speaking is something many people fear more than death itself. So they took a group of volunteers, and they divided them into three groups. They had a control group that they did nothing to. They had an ignore group who they gave them the instruction to ignore the stress associated with public speaking. And then they had a cognitive reappraisal group, and the reappraisal group was told, think of this as not as you're afraid, but you're excited. That increased heart rate, that's excitement. Your sweaty palms, that's because you're excited to give this speech and communicate your message. And so having them all do a small public speaking session after giving these, within these three groups, they assessed them afterwards and found, this is called total peripheral resistance. This is basically a measure of the amount of constriction in your blood vessels in your body. They found was the control group had very high constriction, a sign of a pretty powerful stress response. The reappraisal group had only a third as much constriction as the people in the control group. So it physiologically changed the body's response based on what they were thinking in their mind. They also measured cardiac output, which is a measure of how fast your heart is beating and how strongly it constricts. Faster and stronger is an increased stress response. More relaxed and slower is less. The reappraisal group had cardiac output reactivity much less than either the control group or the ignore group. So the way this works is if you are part of the control group and you do not have this reappraisal strategy, you get a physiologic arousal from the stress, your stress response. Then your mind puts a label on it. You get a negative assessment. Oh, I'm going to bomb this. This is going to suck. I hate public speaking. I'm so embarrassed about it, whatever that is. And it gives you a maladaptive physiologic response. It can have you be hyper vigilant for threats, and it can screw up and impair your performance. With the reappraisal, you still get the physiologic arousal and the negative assessment, but then you stop. You do a reappraisal and say, wow, what does this really mean? I'm excited, I'm not scared. And that gives you an adaptive physiologic response, one that's healthier and nurturing. It reduces your desire to search for threats, and it facilitates and enhances your performance. So I encourage you to play with when you notice yourself feeling afraid or about whatever it happens to be, seeing if you can catch that internally and turn that fear into excitement. Another part of the relaxation response is the release of oxytocin. It is also referred to as the love hormone. It's part of what makes you feel attracted to other folks. It makes you more social, increases your empathy, increases your desire for social support, both to give social support to others and to seek it yourself. And it is an anti-inflammatory chemical. And there are some things you can do to trick your nervous system into releasing more oxytocin in the moment. You can actually do this yourself. And I learned this framework from George Leonard, who has since passed on. He's one of the founders of the Esalen Institute and a multi-level black belt Aikido instructor. And it goes by the acronym of GRACE. So the first one is to ground, and that's essentially to use your toes. And you can do this right now with me on the phone. Many of you are in your living rooms, no one else can see. But just use your toes like you were gonna pull the carpet or the rug, whatever's underneath your feet, back towards you and bunch it up underneath your foot. The reason that works as part of the stress response is to decrease the sensation in your extremities so that if you get bit by a tiger, it won't hurt as much and you can fight or run continuously. Next one is to relax. And I know relaxation sounds crazy, but most of you have some place in your body where you hold your stress. I tend to be a shoulder and neck stress holder. Some people hold it in their fists, some people hold it in their belly, a lot of people hold it in their jaw, but it's to just know where you hold your stress and just consciously move and shake out that part of your body where you hold stress. Next is to be aware of your stress response signals. The stress response is similar for most of us, but our cognitive awareness is a little bit different. For me, getting stressed, I notice my peripheral vision get fuzzier first. It's the first thing I notice. And that awareness pulls you out of it a little. The C stands for centering, and in the martial arts, they teach you a lot about centering. And physiologically and anatomically, your center is just about an inch beneath your belly button. So if you want to reach down right now, again, I'm sure that there is some HR person who's reacting to me inviting 3,000 people to touch themselves simultaneously, but it's okay. We're among friends. So just touch yourself just beneath your belly button and kind of poke in there a little bit and just take a breath and bring your attention to your fingers right there. That little bit of centering can help release oxytocin. And the last one is to energize, and it's to actually warm up your fingers and hands. And if you want a poor person's biofeedback system, back when they open up again, the hardware stores, they've got those thermostats. Some of you may have one of these at home. Digital thermostat with the probe that goes outside and measures the temperature and the digital metric inside. You can put your hand around one of those probes and you can take breaths and think about different things and teach yourself how to raise your temperature. It's a biofeedback device that you can use yourself at home. The next, and this is really a powerful strategy, is the practice of meditation or mindfulness. And we used to think of this as monks in orange robes and yoga teachers and that kind of stuff, which it absolutely is. But it is absolutely a cutting edge technique. All branches of the military have mindfulness practices now. The top 22 commandants of the United States Marine Corps meditate on a regular basis with one of my former meditation teachers. And there's a lot of good information about the science around this. A couple of great books. Daniel Goleman, he wrote the book Altered Traits, and in the post-conference sheet that Shannon mentioned at the beginning, we'll and give you a link to both of these books. It's essentially like taking your brain to the gym. And of all the mindfulness techniques out there, Dan Goleman will say, if you ask him, as my wife did when we saw him recently, said, what's the best meditation technique? And his response was, whatever one you'll actually do is the best one, which is good advice. My personal favorite comes from Dan Siegel. He's a psychiatrist at UCLA, director of the Mindsight Institute. And this is a wheel of awareness meditation. And if we were in a live workshop, I would invite you all to meditate with me right now, and I'd walk you through it. But we're not going to do that on the webinar, but we will provide a link for you at the end that takes you to Dan narrating his own wheel of awareness meditation. You can think of this as a tactical meditation. It's 4 parts, and it starts by first kind of paying attention to each of your 5 senses. And then he walks you through an interior scan of your body where you kind of imagine your brain relaxing and your jaw relaxing, and then your bones settling and relaxing. And it's a very, very nice experience. The 4th kind of category in this meditation is just noticing your mental activity. It's not about trying to stop it. It's just about noticing it. And then the last part is about relationships. And one of the things my friend who's on the line here, Yuri, has definitely taught me, and there's a lot of neuroscience to back it up, is the importance of relationships in the world, and particularly at a time where we are physically distancing. Just taking a little bit of your meditation to really connect with the people in your world that you care about. I also always finish my wheel of awareness meditation with just a little bit of a loving kindness meditation. I've been meditating daily since I was 14, so I've got a lot of things to draw from. But I always end my meditation with may all beings be happy, healthy, and free of harm. And just seems like it's particularly helpful in this day and age. So we'll give you the YouTube link to Dan's narration of that meditation at the end. Another thing, mindfulness practice that's also really fun is a chocolate-based mindfulness practice where you're going to eat a piece of chocolate and you take a moment to really smell the chocolate and take a little bite and let it melt in your mouth, and just really be focused and aware of the chocolate as you eat it and swallow it, so you can get your sweet tooth on and get a little meditation practice on at the same time. I'm going to switch gears here, kind of for this last part, to talk about leadership, and Yuri has written a wonderful book on executive resilience that has a great section on leadership and kind of translate stress management and resilience building into leadership strategies. And one of the things that's important for leaders to keep in mind is there's an open loop nature of our limbic system. This is essential to survival. It basically means that the limbic system isn't just in your brain, it's in relationship. So it's what allows parents to calm an upset child, those kinds of things. And in the leadership world, as leaders, it's really easy to forget how big an impact that you have on other people's, not only their jobs, but you also impact their physiology through what's referred to as interpersonal limbic regulation. You can actually alter the hormone levels, the cardiovascular function, the sleep rhythms, and immune functions of other people through your leadership styles. Just think about how contagious a yawn can be. One person yawns, and then kind of like everybody in the room starts to yawn. And when you're a leader, people really look to you, and whatever you kind of got tends to spread. And you can think of it as your employees and your team members are all on a roller coaster with you in the front car guiding things. And one of my favorite leaders, this is Norm Dinerman. Some of you may have seen him in the book The Knife and Gun Club from my old employer when I was a street medic at the Denver Medic Division in Denver, Colorado. Norm was an attending physician in the emergency department at Denver General Level 1 Trauma Center. And we were a training hospital, so we had interns and medical students and paramedic students and nursing students. It was a pretty wild place. And when you brought in somebody who'd been shot or stabbed or a major trauma into the major trauma room, there's a lot of people in there, and it tends to be pretty loud and hectic, except for Norm was the attending physician. When you walked in, when Norm was the attending physician, there would be, 25 residents, nurses, and all that kind of stuff, absolutely quiet. I would say, let's listen to the report from the, and you would give your report, and Norm would say, are you complete? And you say, yes, and they'd move the paper. It didn't take any more time than any of the other physicians who were leading did, but it was quiet, orderly, and really, really connected, and I think provided really good health care as well. So in the time of coronavirus, it's important for leaders to really remember they need to connect with their folks, and on an emotional level, and it's okay to be personal and say, how are you feeling? How are you doing? People need to be fed, and people who are spending their day in personal protective equipment, many of them are not eating adequately. So making sure that they eat before they gown up, and have the resources to be able to feed while they're on duty is really a vital thing. Same thing with hydration. I know there's a shortage of PPE in many places in this country. We have a real responsibility to make sure our people are as protected as we can, and make sure to include everybody. Just because you're not a frontline police officer, paramedic, firefighter, nurse, physician, PA, correctional officer, whatever, doesn't mean that you're not stressed and absolutely contributing to this. Your mechanics, your housekeeping staff, your dispatchers, they're all involved, and you want to make sure to include everybody. So as we wrap up here, in the stress management, don't forget that stop and taking a breath every now and then is important. And I do not advocate the use of recreational substances, but the breathing pattern that people use. I know none of you on here have ever smoked cigarettes or marijuana, but you've seen movies or TV shows where people have that breathing pattern where you take a really deep breath and you hold it and then blow it all the way out, and imagine smoke going all the way out. That breathing pattern in the law enforcement and military world is referred to as tactical breathing, and it is one of the things you can do any point in time, no matter what you're doing, where you're doing it, to help dial down your stress a little bit. The things we've talked about here today, they take your high stress down low. They won't wipe out your stress. It's just not wipe outable in this day and age. But we can take it from high to moderate and drop it down a little bit. The one of the things that there are people who are experiencing enough stress that they're having signs and symptoms of PTSD, depression, anxiety. Those are kind of expected reactions here. If you're looking for help, I am not a psychotherapist. I'm not the person to talk to. One of the reasons that I have found has been put together and by our friends at Global Medical Response and Janelle and her team, the All Clear Foundation, and we'll have the link in the thing afterwards. It has got lists of resources, peer folks. It is the best collection of resources and support for folks who do what you do. So with that, I want to stay cool. Thank you so much for attending today. This is my son Axe. Part of my contract is he has to be in every PowerPoint presentation. And now I will slide over and go to questions here. Let's see here. We've got
Mike, this is Shannon. Sorry. First of all, thank you so much. That was excellent. And I'm a task-driven person, so I think I'm going to definitely add that 5-minute worry session into my calendar for sure. Great suggestion. I know you're going to go through the questions, so I actually put a green flag next to the ones to separate them from the technical questions. At least until we start to get more in here. So you might look for those green flags if that's helpful.
Oh, there we go. I have to open it up here a little bit. So one of the questions from Sheila is, what recommendations do you have for responders who are feeling helpless and anxious and depressed as a result of their work, I really encourage you to check out the All Clear Foundation website. They have a great many set of resources, and you definitely want to definitely get help. Let's see. Ryan asked the question: do you think we need to worry about occupational exposures versus infectious exposure? Right now, I believe many first responders don't know the difference in these terms. Hypervigilance at this time. That is a great question, and to tell you the truth, it's outside of my expertise. Ryan, if you will send me an email at the email that's on here, I will hook you up with my friend Pam, who is an infectious disease expert, who will be able to give you much better information around that. Cheryl asked the question: has anyone studied the relaxation techniques of Reiki? A wonderful anecdote to stress. Cheryl, if it works for you and it works for other people, I think it's wonderful. I certainly do relaxation if I've had it. And actually reports to Greg. Greg says, my 5 worry session tends to start when I go to bed. I like the idea of an alarm to end worry. Any tips on falling asleep? And that sleep is such a challenge and such an important one. One of the ones that I have really good luck with around this kind of stuff in particular is I will take a pad, and I do it in hand, not on a device, but I actually really write out my worries, not editing or whatever, just do a total brain dump. And then when I'm done with that brain dump, I turn it over so that I can't see it and look at it as I turn out the light. There's something about knowing that they're all there, so I don't have to hold them in my brain. And making sure that your 5-minute worry session that you schedule is not right associated with bedtime is a good strategy. There also are a number of other fabulous strategies that you can use to help yourself get to sleep and stay asleep. And we can add some of that to our resource list later on. Shannon and I will do that. And then Jennifer said, responder, the innate personality traits to our profession, and then sit with how the traits may interfere with moving from maladaptive to adaptive strategies. Often providers do not even realize their choices are maladaptive. We often emulate each other unconsciously. Choosing great mentors is also important, and that, Jennifer, you've highlighted something that's particularly important. And in the military, one of the things that they have found is that the quality of frontline leaders that people interact with regularly has a huge impact on people's ability to move from maladaptive to adaptive responses to stress. So I really appreciate your comment there. And then Craig said, does the management of stress effectively deal with physical manifestations of viruses specific to COVID? I actually do not know. I spend a huge part of my day connected with people who are managing COVID, not only on the front lines, but CD, WHO, the team at Johns Hopkins. That's how I spend a huge part of my day. I am pretty clear that the amount we know about this virus greatly exceeds what we do know about it. Especially in the world of healthcare in general, the more you're able to dial down your stress response, the more it builds your immunologic system and its ability to fight off diseases. And I would think it would be helpful in any circumstance where you're faced with any kind of an infection. Let's see. I had read that having shortened telomere related to a shortened lifespan, stress contributes to shortening. And it is true. There's actually a genetic issue that some people are born with super short telomeres, and ones that end up with gray hair and wrinkles in old age when they're 10, 11, 12 years old. And and unfortunately, most of them have an early death. So stress contributes to stress, and unskillfully managed absolutely contributes to shortening of your telomeres. And the practices of good stress management, particularly daily mindfulness practice, can really improve the lengthening of your telomeres. Paul said, in light of the extremely long hours many medical professionals are to do in separation for their families to protect them when they're off duty, what tools do you think would be most effective for them? That is a really, really good question. And you know, any one of those tools that I suggested, that it's kind of the same as the Dan Goleman advice on meditation. It's whatever tools you'll actually use. Everybody's kind of got their favorites. Deep breathing is a big one. Some people really like writing out their stress. Other people, that kind of labeling their emotion in the moment and reframing it is particularly powerful and effective. And these are things that it's important to teach our families, particularly during these times of separation. Harry said, I understand the material and emphasis on mindfulness, but many of the first responders in my area come from a Christian culture. So how might Kaplan explain the 7th, 8th, and 9th level wheel with a Judeo-Christian worldview? That's a great question. And there, in my experience, that there's nothing in conflict with mindfulness practice in a Judeo worldview. One of my first trainings in meditation, I went to the Naropa Institute, which is a Tibetan Buddhist college in Boulder, Colorado, years ago. And once a month, we would have an entire silent meditation practice. And the first day I showed up to the meditation practice, there were 2 priests in full collar and 5 Catholic nuns with them in full habit. And I was confused. And I at lunchtime allowed to talk to one of the priests, and I said, Father, can I ask you a question? And he said, sure, ask away. And I said, does the Pope know you're here? I mean, are you going to get in trouble for being at like a Buddhist meditation retreat? And he laughed and he said, there are contemplative meditative practices in the Christian tradition. Thomas Merton is one of the big authors in that realm, and it in no way conflicts with my Christianity to practice mindfulness. So thank you for your question there, Harry. Carmen said, very often the stress of a workday stays with you just below the surface and can be triggered during a commute home or even later at home. What's a good way to release pent-up tension before inadvertently releasing it later? Boy, this is such a good question. And I was exchanging messages with a friend a couple of days ago who works in an emergency room in New York City in the thick of the crazy stuff, and he's really attentive to be compassionate with patients, realizing that some of his patients are going to die without their family members close, and that he's likely to be one of the last people that these people see before they pass. So he's been, really giving all day, and then it's like, okay, the car on the way home, kind of letting it down and relaxing and getting home and stripping off his clothes in the garage so they can bag them and put them in the laundry, and then go straight into the shower before seeing the kids. And he's now actually shifted to sleeping in a separate room from the family because he does not want to put his family at risk if there's any chance that he might be bringing something home. But he talked about snapping at little things like dishes or you get so hyper vigilant with your personal protective equipment that when people at home don't follow the basic rules to wash their hands well, or not just bring in the Amazon packages and open them up and then make lunch, that he just had a hyper angry response about a package kind of issue. So that just being aware of this is hugely helpful, and pulling off to the side of the road a little bit and just spending a little time having a good cry, or it up, or rolling up the windows and yelling at whoever you want to yell at, to just intentionally release it. And remember that the folks at home are as stressed about all this stuff as you are, maybe not to the same level, but in different ways. And that your kindness and your love and your compassion, you got to save some for your family. My sister frequently says, always make sure that you save your best stuff for those at home. Do I have any other resources or suggestions for 911 centers? And we spend at the company I work for, we spend a lot of time in the emergency dispatch realm. We've been hosting weekly webinars on new protocols for dealing with callers and all that kind of stuff through the emergency medical, fire, and law enforcement dispatch systems. And one of the things about a dispatch center is you can set things up so that you can be protected from interacting with the virus during your workday. But just as a team, there's something really valuable about coming in a few minutes early before you take up stations at your consoles, and everybody being together because you're not social distancing as much, and just kind of checking in, kind of gearing up and saying, hey, we're gonna dealing with a lot of really stressed people today, including our coworkers on the street. Let's do our absolute best to take care of them. And then at the end of the day, doing a check-in with everybody to say, how's everybody doing? Anybody need anything to do that dial down and debrief before they go home? That's great. Mary asked, what's the single most important thing you would suggest law enforcement leaders do for their personnel right now? I think that first thing of really checking in with them, and it depends on the department. Things have certainly evolved over time, but historically, emotions and feelings have been that permissible to talk about in many law enforcement circles. So having that one-on-one connection with how are you doing, and then pause for a second, say, no, how are you really doing? And then just be there to listen. You're not going to take it on and fix it, unless it's something you can fix. But more often than not, it's just going to be about listening, and saying, how are you doing? How are your interactions with the public? If there are policies that you can change about who you interact with, or what kind of calls you go inside on, or those kinds of things right now, I think you should absolutely do it. But that really connection and inviting people to talk about how they're feeling is critical for everybody. Zach asks, with PPE shortages, how can we instill confidence in staff when PPE is being used beyond their recommended usage? This is a huge issue, and there are all different kinds of things that are being researched and developed to prolong the life of PPE. I saw something the other day that expired N95 masks, the main thing that expires on them is the elastic. So coming up with ways to add the elastic and use expired ones. Everything that you're actively doing as a leader to acquire more personal protective equipment for your folks, and those kinds of actions, making sure that everybody knows exactly what you're doing, so that entire process is transparent. And if anybody on your team has suggestions for for folks and sources and strategies. Just make sure that what's being provided is actually effective. I saw a research study recently that just the cloth masks and bandanas, the ones that are being sewn at home by themselves, really allow the virus to pass through. So you want to make sure that there's as much science as you can behind any evidence or any things you're using, particularly for the decontamination of stuff that you're going to use more and more often. The next question, can you discuss the difference between worry and anxiety and how you can cope with anxiety versus worries? That's a really, really good question. So, I've heard it, and I am not a psychologist and I'm not a therapist, so I need to make that clear. And there's likely to be resources that you'll find on the All Clear Foundation that may give you a more authoritative answer. Worry is kind of about kind of predictions about the future or concerns about the future. Guilt is kind of focusing on the past and things that have already happened. And being in the present is kind of what mindfulness teaches you to do. But anxiety is really worry that you can't turn off, and it tends to be free floating and less specific. For myself personally, I don't find making a big distinction between the two helpful. But Eric, if you do, I would love to learn more about what you're thinking. The next question is, do you suggest meditating every day, or do you meditate just a few times a week? I've been meditating daily since I was 14, and it's like, if you want to learn to play Stairway to Heaven on the guitar, if you play it every day just a little bit, you'll get better at playing Stairway to Heaven faster. And if you practice your mindfulness every day, even if it's short, you can do a super short version of the Wheel of Awareness meditation in 90 seconds if you speed through it, and you'll still get benefit from it. And I'll tell you, since the coronavirus thing has fired up, I've increased my personal meditation to twice a day. I do my Wheel of Awareness meditation every day, twice a day, and I find it particularly comforting and helpful. And then the last question that's highlighted here, any ideas on relating with stress or worry that my family, spouse, or kids are having about me working and bringing home illness? So I think having honest conversations, from all the things I've read, and there are some great resources on the internet. And if you send me an email, I will send you some of the studies I've seen by psychologists and psychology associations about how to talk to your kids about the coronavirus and issues. And it's kind of be gauged and age appropriate. With our son, we focus on telling him the truth. Is it scary? Yes. Are people dying? They are. Is it worse some places? It's right now it's worse in New York, and his granddad and his aunt and uncle and folks live, and his grandmother live in New York. So he gets a little extra worried about that, and when he's a little bit worried, I'll say, what questions do you have, and just try to answer the questions as honestly as possible. And then I comfort them by saying, I am doing absolutely everything I possibly can to keep me from getting the virus. And here's what I'm doing. I am wearing my eye protection. I am wearing my mask and facial protection. I am obsessive about my hand hygiene. And if there's any risk of it being on my clothes, I take my clothes off before I come see you. And I know I want to hug you when I get home, but I'm going to take a shower first. Whatever actions you're taking to protect yourself and your family, reassure them by making it explicit. I'm doing everything I can, And is that a guarantee that I won't get it? No, but I'm doing the very best we can, and that's all anybody can do in our world right now. And just stay with them, and when they're afraid and activated, you know, you can. I just gave you a whole pile of techniques which you can play this video for them, and as a family say, you know, let's you can fast forward through all the neuroscience and all that kind of stuff and just go to the techniques for managing stress and say, you know, as a family, let's figure out who wants to pick which thing to be theirs, and then you can kind of reinforce and support each other. If you're going to be an emotional labeler and you're going to be a reframer and you're going to be a deep breather, you know, whatever it happens to be, but just make it a family project and a thing that you can do together. Great. That is all of the flag questions that we have at this point in time. Shannon,
Yes.
any other questions that you're spotting that
So,
we should deal with right now?
Mike, we're getting so many, and I appreciate everybody's questions. So we're going to do our best to capture those and get those to Mike in a report. Um, and if for whatever reason you know need to contact Mike, he's been generous with his time today and leading up to this webinar, and has told me that he would be happy to take questions as well. So you can feel free to contact him at that email
Absolutely.
address there on the screen. And thank you, Mike, for doing that, and for your honesty and in this presentation. And I think you gave us some great techniques as well as just a lot to think about. So I really appreciate your time and everything you shared. I appreciate First Watch for lending your time here today and letting you making you available for this presentation, and I thank them as well. We've referred to a lot of resources throughout the presentation. You see the link there on your screen. Please visit that page. We'll be posting the webinar recording later today, and we'll try to get a PDF of the slides up there as well, and you'll be able to access a lot of the resources Mike has referred to. And we should be sending an email out by the end of the day as well with that information. So be sure to watch for that. Mike,
Uh,
any final words?
my only final words to you is that I hope you're happy, I hope you stay healthy, and I hope you stay free from harm. Thank you.
Excellent. Well, on the behalf of everyone here at Lexipol, Police One, Fire Rescue One, and EMS One, thank you so much to everyone who attended today for everything you are doing out there on the front lines of this epidemic and this crisis. Please do everything you can to keep yourself safe, your family safe, and your community safe. Thank you, and we will see you again soon. Take care.
Thank you.